Here, what is atrial septal defect? Atrial septal defect is that where there is a defect in the septum such that blood goes from the high pressure left atrium to the low pressure right atrium. So why does this happen? Ideally, here we need to have the foramen ovale. The foramen ovale is supposed to close after birth, but if the foramen ovale is patent, then it can rise to atrial septal defect. The reason for atrial septal defect is patent foramen ovale. This is the first simple basic thing that we should know. The second one is, what about the heart sound? So here there is splitting of S2, and it is not a normal splitting, it is a wide splitting of S2. So this is in basic, this should be you should be able to know that wide splitting of S2 is seen in atrial septal defect. The pathology is not, pathophysiology behind it is not much important, just remember it. What about the murmur? The septal defect per se doesn't cause murmur, but when the blood moves from the left atrium to the right atrium and from the right atrium to the right ventricle, and the blood enters into the pulmonary artery, here we have the pulmonic valve. So normally the amount of, so now since there is a septal defect, there is a large quantity of blood which is transferred from the left atrium to the right atrium. Say for example, the right atrium as such has about 30 ml, I am giving an example. But since there is a septal defect, the high pressure left atrium pushes some of its own blood into the right atrium, right? Say it pushes again another 20 ml. So the quantity of blood which is received by the left atrium because of the septal defect is high. When that quantity of blood enters into the pulmonary artery through the pulmonic valve, it produces a murmur. Since it produces a murmur, when the right ventricle undergoes a systole, the blood enters into the pulmonary artery, thereby a large quantity of blood enters into through the pulmonic valve as such. Therefore, you have a systolic murmur. In atrial septal defect, what do you understand by wide splitting of S2 and wide fixed splitting of S2? So here, before we go there you should know that what is S2. S2 is nothing but the sound which is produced by the pulmonary artery as well as the aorta. So here we have the aorta. So the sound that is produced by the pulmonic valve as well as the aortic valve. Normally the aortic valve closes first, but it will take a few more milliseconds later for the pulmonic valve to close. Why? This is because all the blood from the right atrium, the venous blood from the right atrium, it takes time to enter into the right ventricle because the quantity is large, the preload is more, and it takes time to enter the right ventricle, and it has to push blood through the pulmonic valve. It does too, but it takes a little bit extra time. Excuse me for a minute. Let's continue with wide splitting of S2. So as I told you, the pulmonic valve takes a few more extra milliseconds to close, right? So it follows the aortic valve. But when there is a right ventricular hypertrophy, then it takes even more time for the right ventricle to empty into the pulmonary artery. That's what you should know. So when there is a wide splitting of S2, that is when there is only wide splitting of S2, what does that mean? That means A2 has occurred, and instead of P2 occurring at this place, P2 is taking wide splitting. P2 is taking even more time to happen. So this happens because of a right ventricular hypertrophy, because as such there is no place for the venous blood to enter into the right ventricle because of right ventricular hypertrophy. Now whatever blood that has entered into the right ventricular hypertrophy has to be pushed by the right ventricle into the pulmonary artery, which takes even more extra time. Therefore, wide splitting of S2, when they give you only wide splitting of S2, that means they are hinting towards right ventricular hypertrophy. But on the other hand, when they specify this word wide fixed splitting of S2, it clearly means that they are talking about atrial septal defect. Fine. Now what is the concept of a paradoxical emboli? Paradoxical emboli is nothing but, see, when there is a atrial septal defect, there is an atrial septal defect in this patient, and they are unfortunately they are also having a venous emboli, maybe due to prolonged immobilization or due to whatever be the reason, there is a venous emboli. The venous emboli is supposed to stay in the venous circulation. There is no place for it to enter into the arterial circulation. But if there is an atrial septal defect, then the venous emboli can enter into the atrial system, I mean the left atrium, and through that the emboli which is started and which can result in a DVT or any other pathology can enter into the arterial system, can go through the aorta, and it can result in stroke or transient ischemic attack or retinal artery occlusion or anything for that matter. So this is known as paradoxical emboli. When the venous emboli enters into the arterial system because of the atrial septal defect, that is known as the paradoxical emboli. Fine. So these are the concepts about atrial septal defect. Now if you are appearing for step 2 CK, they might go a little bit further and ask you what are the indications for surgery in a patient with atrial septal defect. There are 4 main indications. So any septal defect, when the patient is suffering from arrhythmias, they should undergo surgery. This is one topmost indication. Second, as we had already seen, when the patient is having a paradoxical emboli, then we cannot allow this to happen. So therefore, they need to be operated. The third is when there is a right ventricular hypertrophy. What does it mean? The pressures are getting, the right ventricle is not able to handle the blood, right? So therefore, it is undergoing a hypertrophy. So when there is a right ventricular hypertrophy, then when there is a right ventricular hypertrophy, then it needs to be operated. Similarly, when there is a pulmonary hypertension, that means, why does pulmonary hypertension happen in atrial septal defect? This is because when the flow of blood from the left atrium is, when the quantity of blood from the left atrium, and there is a large quantity of blood entering from the left atrium to the right atrium and from the right atrium to the right ventricle, and there is a large quantity entering through the pulmonary artery into the lungs. There is excess of pressure in the lungs, right? The lungs also cannot tolerate the larger quantity of blood. Therefore, that can go for pulmonary hypertension. So when there is any changes in the heart, right, like right ventricular hypertrophy or pulmonary hypertension, or if the heart per se is reacting with arrhythmias, or if there is paradoxical emboli, then it is an indication that it needs to be operated. Thank you for listening all this while. Have a good day.